We're back. Allscripts teaming up with Microsoft to allow patients to access their medical records online. Part of a system called Healthvault. And we told you about that on CNBC last week. Joining us now for a first on CNBC interview, fresh off opening the NASDAQ, Glenn Tolman, Chairman and CEO of Allscripts. Good morning, sir. Thanks very much for being with us.
Good morning. Happy to be with you.
So patients get to access this information, is that right?
Well, that's right. For the first time, along with Microsoft, we've been able to enable patients to access the electronic highway.
Okay.
So they're now connecting with physicians.
All right. The first question has to be about how secure is this data?
Well, the data is very secure because you have to go through your physician to get any information that the physician has. And that means that you'd have to give the physician permission to release any information and upload it to your Microsoft Healthvault account.
How widely available is this right now? I mean, I'm just trying to get a sense of how much of this is what the goal is that one day the world will be like, and how much of it is I can actually access it, use it now.
Well, the great news is that Microsoft is a known name, and when Microsoft entered the market, they essentially said this is going to be available to all patients free of charge. Allscripts is the largest provider of electronic health records to physicians. So some 40,000 physicians are enabled both through Allscripts electronic health records as well as through the National Electronic Patient Safety Initiative. So we've got broad access, and it's growing every day.
And does it matter, you know, so much of the issue appears to be when you go to the doctor and then you need to, you know, you move states or you have a medical issue in another state, you know, who your insurer is and this whole issue of crossing state lines. Does this just eliminate all of that? Doesn't matter who your insurance company is or if you switch insurance providers?
Well, the good news is this puts the information in a patient's control. And that's really what it's about. It's about giving the patients portable information that's available anywhere they are through the internet. And we're connecting that with the patient's physicians. So a patient may have 3 or 4 different physicians. Now all of that information can reside in their Microsoft Healthvault account.
Yeah, now all we need to do is get the doctors and nurses to read it and not ask the same question 10 times. So
well, that's true. This will eliminate the clipboard, so we're excited about that.
Not really, no. I'm sorry. I've sat there and had a doctor ask me the same question 3 times in a row. And I give him the same answer 3 times in a row. And say, oh, yeah, right, I remember now. Who's your main competitor?
We have a number of competitors in different areas of the market. So the real main competitor is paper, because most transactions today in healthcare are done on paper. And just as you mentioned, it's the clipboard, it's paper, and it's getting physicians to adopt the technology and getting patients to use the technology.
So you kind of see yourself, and correct me if I'm wrong, it seems to me you see yourself as not only part of enabling patients and speeding the flow of information and hopefully improving its accuracy with the doctors, but you're also part of the cost-cutting effort here.
Well, that's
right. You've
right.
got to hold down costs.
That's right. If you take out the paper out of the process, you're going to make everything more efficient. And really what we're doing is bringing the same level of automation to healthcare that we have in every other major sector of the economy. I mean, you wouldn't go to a bank and see them filling out manual papers. You couldn't use an ATM. This is really the ATM for healthcare. That's what we're building.
And one last question for you. A recent report said that your company would benefit from Hillary Clinton's proposed health care reform in this country, saying that 40% of the funding for that plan would come through cost savings from things like online health care records. Do you have an endorsement here? Do you like Hillary's plan or no?
Well, we think that any of the political candidates, whether they're Democrats or Republicans, are going to have to look to use automation to help both improve the quality and reduce the cost. So any plan, whether it's Hillary's plan or Barack Obama's plan or any of the other plans, we're happy with those plans as long as they're pushing healthcare automation. That's better for patients and it's better for all of us.
And a very diplomatic response indeed, sir. Thank you very much. We appreciate you being with us, Glenn Tolman.
Thank you very much.
Up next, more headlines.